if your clinic is not branding on social media, on digital platforms, you will fail. You will shut down. You might as well give up right now.
Your brand goes beyond your logo and your color schemes. It's your opportunity for growth.
I love AI in healthcare extensively for imaging and for pre-assessment and analysis. AI is very exciting when it comes to this, but the one thing that has not evolved is patient communications. Do you feel like that privacy and that intimacy of healthcare industry is tarnished? Welcome back. It's Sam Patel. We're going to talk about everything aesthetics and wellness. For those of you that are new to our podcast, please hit subscribe. We're so looking forward to this conversation so you can take actionable items back to your practice and back to your patients, because we want to make the most out of learning together. And I cannot wait to learn with you today about the hottest topics. And I have Alicia here with me to come help us learn some more. So Alicia, we're going to walk through some amazing conversations today. Hot topics, the ones that we've been hearing so much around the world. All the conferences we've been going to have been talking about these topics. So I said, hey, let's talk about it here today on this podcast. It's going to be topics in regards to AI and how that's impacting healthcare today. Marketing, whether they should do it or not. Clinics are doing marketing. Should they not? Should they be on social media? Should they not? What's the concept here? And then lastly, patient engagement, how to get them back in. How to talk to patients, educate them, not just try to make money off of them, but make them a better healthcare outcome. How can we impact that post-care? These are all the latest topics we're going to talk about, but let's start with one of the easiest and one of the biggest, but also one of the most discussed, and that is branding. We know branding has so many layers to that when it comes to, hey, your identity, what your logo, your mission statement, your Instagram. I mean, branding goes into such a rabbit hole. But branding, is it important in healthcare? A lot of clinics we deal with every single day for consulting always ask, hey, do I need to have a brand? I mean, do I need to be on social media? Do I need to have a website? Is it necessary? What are your thoughts?
I definitely think it's very important. Your brand goes beyond your logo and your color schemes. It's your opportunity for growth. And I think one of the most important things is trust with your patients. They recognize who you are. You have proper branding. They're going to be returning customers and want to have it be a referral source for you as well.
Yeah, trust is the big factor here, I believe. I think that now branding is so powerful to build trust before they even come in, right? I mean, I do it. I look at a brand before I even go there or shop there or visit that place. I look at their social media. I look at their website. I look at their reviews. And as you said, all of this does one thing: builds trust or breaks trust. So you feel that it is necessary for healthcare clinics, because healthcare is almost an intimate thing, right? It's always been held so sacred and private. And for healthcare clinics and for medical practices to start branding themselves and putting themselves out there, I think there's a lot of stigma, perhaps maybe with the older generation doctors. What do you feel about that? Do you feel like, that privacy and that intimacy of healthcare industry is tarnished by branding?
I definitely don't. The clinics that I am more gravitated towards are the ones that are putting out educational resources for me, or they're showcasing and highlighting their services. It just makes me really build a trust. I'm like, okay, I'm going to trust them. They're educating me. I'm going to feel comfortable kind of going into their space. So I definitely think it goes beyond, the age and the demographic of what the provider is or what they're pitching or what type of clinic it is, whether it's insurance or whether it's cash-based clinic. I don't think that it really matters.
So it sounds like, from your point of view, and I agree with you actually, is it's about educating them on what services you provide. That's how you're branding. So you're saying, hey, we are a wellness clinic. We do medical weight loss. This is what medical weight loss is. This is how we conduct business here. This is how well I'm certified. That sort of branding, kind of giving that confidence of what you do, how you do it, and who you even are. So is that sort of branding that you feel like is making clinics more successful, the ones that do that?
It is. It's definitely earning the client's trust. I'm educated on what they're selling me or what I'm going in for, that it's earning my trust, and I'm going to feel comfortable kind of going into their space, which kind of leads me into, are you showcasing your space? Are you highlighting your providers? And will I feel comfortable now walking into that space? I understand what you do. You've educated me, but what is it going to look like for my journey if I do become a patient?
So branding, also the experience. So you're also kind of saying, hey, we as a brand have a unique experience, not just with our providers being skilled in different services, but also branding the experience. I think that's brilliant, because we have to make sure patients are coming in and saying, hey, how does it feel if I was a patient? They almost want to get a glimpse. I mean, we do that all the time, right? Before we watch a movie trailer to see, is this a movie I want to watch? Before we go to Disney World, you look at YouTube videos of what's the rides I want to do. You always kind of scope out before you make that commitment. So it actually makes sense. I think people want to get a visual these
they want to
days.
map out their experience of what they think it's going to be like before they walk in.
In terms of branding, I think that there's a massive conversation of social media playing into this. We know that having a brand with a good website and some media ads and all that good stuff is important. But social media, we see this a little bit more with the older generation, physicians and nurse practitioners, of being a little bit resistant to social media. Maybe they're just thinking it's a waste of time. What would you say when it comes to branding yourself on Instagram, on Facebook, these sort of platforms?
Definitely think consistency should be there, but I think that Instagram does play a key role into promoting themselves and their business. I don't think that it necessarily matters what your age is, or if you're one of the older generations or one of the newer generations. There's a lot of resources out there for companies to do it for you, or companies that can train you, making sure that you're optimizing it to its full potential and that you are displaying yourself digitally in the correct manner on how you want your brand to be portrayed.
Yeah, I mean, before it was you opened up a magazine, you saw a beautiful ad of a doctor and a clinic maybe in the setting he was in, and maybe some bullet points of what they do. That was branding. And now we actually have an advantage, I think. I think social media and the cell phone and digital era is a massive advantage, because if you are a good brand, if you have amazing team members, you have a beautiful space, a beautiful clinic, and you have amazing services, you have an advantage. Show that off. And videos, audio, all of the social media, YouTube, all of the video engagements that we have, that's your actual opportunity. You can't capture that in a magazine article.
No, and a lot of times the magazines it was all stock photos. It wasn't that actual doctor or that space that I was going to be invited into.
It was the same guy in the white coat or the woman in the white coat, and it was the same photo every clinic used.
Yep. And you walk into that clinic, it could be paneling walls and they're 30 years behind. Not an experience that I was thinking that I was going to get when I walked in the door based on what their magazine article was. So instantly, my threshold from my expectations were dropped.
Yeah, no, definitely. That makes sense. A couple last sort of talking points when it comes to branding is, do you feel like nowadays your clinic name and your logo and your colors and all of that mean anything? I mean, we see a lot of clinics that have only 7 words, right? They're healthcare center of blah, 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 wellness and aesthetic studio. It's how many words? That's a lot of words for a logo. Do you feel like now that needs to also, because now some people have a really elegant word. So to that detail, what are your thoughts about branding there?
I think clinic names need to be very unique, but single words, maybe 2. I mean, you think about a lot of the big box name stores like Saks Fifth Avenue. They go by Saks. Everyone just calls it Saks. And there's a lot of other Popeyes fried chicken or whatever it is. People just call it Popeye. There's a lot of different businesses that have long names. Everyone always shortens it. Right. So I think just having a brand identity with one single word or 2 words that could be easily recognized, as well as a very catchy logo. So you are represented throughout your community and it's more recognizable for everyone.
Yeah, no, it makes perfect sense. Let's kind of gravitate to another topic that I mentioned earlier, and this is an up and coming topic. It's a topic that I feel is the topic of 2025. 2024 was all about GLP-1s and hormone replacement therapy, which are still big topics today. But I think healthcare has now shed a massive light on artificial intelligence, or AI. AI is impacting every industry. We know AI as, this really intelligent software like ChatGPT. You can type it in, get answers immediately by scoping out the internet and curating, kind of what the summarized information is out there. But we know that AI is now in healthcare extensively. And we have to kind of figure out, how can AI help you? How can it help automate your practice? How can it help you in the consultation setting? How can it help you maybe even sell treatments to a patient or educate patients? What are your thoughts on AI? Let's just generally think about, hey, is it good? Does it have a future, or is it needs to be stopped and needs to be eliminated? What are your thoughts about AI in healthcare?
Yeah, I think AI in healthcare is going to be huge. I think obviously over the next several years, it's going to continue to grow. But I've seen AI start from the moment that a patient goes on a website, an AI bot popping up, wanting to give information right away. And then it continues over to getting that appointment booked. A lot of times the patient or the client does not know that they were speaking to an AI bot the whole time, but it got them in the door. It got them excited. And a lot of them are very smart to be able to learn the algorithm of the clinic and what they're going to be promoting or talking about gets the patient in the door. And then, like you mentioned, the consultation's key because the consultation is going to convert over to conversions. So I think that now with a lot of the new technology that I've seen out there, from the body analysis, from the face and skin analysis, that's going to play a very key role into higher conversions.
Yeah, no, definitely. I think that AI, to your point, we already see it, right? It's on chat boxes, and you would never know. I mean, I've seen some of these sort of chat boxes, and it's very, very organic, and it sounds like or reads like it's a human on the other end.
You can have a conversation with them,
Yeah,
which
you
is
can have
crazy.
a conversation. Even I've seen some clinics that have their receptionist. It's an AI and it sounds like a real human. I don't know about my thoughts about that. You know, my feelings about AI are very similar. I think it's huge. We have to focus on it. I think it's the way of the world. I think it has to be managed properly.
Yes.
You know, with the receptionist being AI, I don't know how I entirely feel about that because there's a lot of things AI is going to get wrong, such as how these treatments work, and misinformation could be given. And it's not, accurate sometimes. And we want to make sure until it is that we kind of use it to a certain degree without 100% relying on it.
Absolutely. And I think that a human does need to be your first line of defense. You need to be able to build that rapport from human to human. I think the interaction and the connection is much stronger that way. But I definitely think that the AI for the bots, getting them in the door, is probably going to start playing a more pivotal role before they are able to actually connect with the clinics.
So I love AI in healthcare extensively for imaging for pre-assessment and analysis. AI is very exciting when it comes to this. Patients now, there's software out there where patients now can take out their iPhone, and the iPhone camera will take a quick photo of them and will give just a generalized assessment of their skin, of their lines, of their volume, and make pre-assessment, not diagnostic options or diagnostic advice, but saying, hey, generally, these are some things that you may want to consider. You're losing this. This is what we're kind of pre-recommending as such. And then the clinic can then say, hey, come on in. Let's actually get you in for a full-fledged assessment. I love this. And another tool that I love extensively is this photo imaging hardware, and I know you know it too, called Aura. It's made by a company called Hexagon. These guys, Hexagon, they're not in the aesthetic industry. They just started dabbling it.
Precision measurements with that company.
Insane.
I mean, it's brilliant that they came out with the camera.
They can go over cityscapes and they can take measurements to the smallest measurement. They do F1 racing car measurements for all the vehicles there to the tiny this millimeter. And so they've used their sort of reputation and their experience to now do photo imaging of the face, and it's one shot. And why am I excited about this? Because they've read thousands and tens of thousands of faces, and the AI has learned, hey, these are wrinkles, these are pores, these are red spots, these are brown spots, these are volume changes. And by seeing tens of thousands of images, it now has learned, hey, this is what you're dealing with. So I can have a patient come in within a few seconds, less than a minute, have an entire analysis on their face, and now I'm no longer having to be the one to say, you need this, you need this. The imaging is telling you that. And patients look at their face and they're like, oh my God, I never knew. And it grades your skin and all this. AI in this sort of context makes me excited. This is where I think AI is going to have a strong future because it helps patients learn, it helps give pre-assessment, and it allows for us to have a conversation that's a little bit more educational rather than salesy. What is your experience when it comes to this, or what are your thoughts about sort of the imaging and AI being used in this context?
I'm really excited about it. And as you've mentioned, I am familiar with the software of Aura, and from the patients that I've been scanning from before and afters, the patient is coming in with one concern. They're coming in because of the deficit under their eyes. And you do the imaging, but they're noticing, oh, it's not just a deficit under my eyes. I have deep wrinkles around my eyes as well, and in my forehead. Or what about my chin? Oh my goodness, you just showed me the proportions of my chin to my forehead to my nose ratio. That needs to be changed. What can I do for that? Or my lips, you said 60-40. They're not. It's by far from reaching those numbers. What can I do for that? So they came in with absolutely one concern, but it gave them like a whole profile view of where different phases they could go throughout their journey with you. And if it's not a service, obviously, that you provide, maybe that's something you want to be able to provide to your patients if some of them continuing to notice some other areas of concerns that everyone's voicing that. And then maybe that's a time to bring on a new technology. But I definitely think the facial analysis is addressing skin, it's addressing muscle, it's addressing the fat in the face. I mean, you name it, it's displaying, and the patient's bringing it up that they want to start these treatments, or how can they fix this?
I think even from an administrative standpoint, AI is very advantageous for healthcare. Just simple things such as, hey, write me an email that I can respond to a patient that's very elegant, nice, and very direct also. So that way you're not having your administrative team kind of sit there and say, what should I say? What should I write back? Or even simple things like, hey, create me a checklist that I can give to my team members to work through the day so they are staying on time. Or perhaps just, hey, you have an AI tool on your phone and you can have it listen and help you write soap notes or help you write your notes.
That's crazy.
Because now you have basically a virtual AI scribe. So these physicians aren't sitting there typing while they're talking to the patient, because no patient wants to look at their physician type away. They want to have a personal conversation.
The engagement's more surreal.
And I understand from the provider standpoint, they have to try to remember everything to document it, because in today's world, documentation is, for insurance and everything. And we have to make sure that we do a good job. So how do we balance a good patient experience by being engaging, but also taking good notes? AI can allow us to actually take our notes for us, record everything, type it out for us. It'll even summarize it based off of what it thinks. And then, of course, the provider can go back and make corrections and make sure everything looks good, because that's important. Can't entirely trust, but it makes us more efficient.
It does, and it brings up a conversation to be able to keep that rapport built with the patient, which builds their loyalty and trust even more. When they come back in for that next visit, it's like, hey, how did school drop-off go for your son? Was it difficult? They're like, oh my gosh, you remembered that. You remembered that I was taking my son away to school.
AI remembered.
Yeah, AI remembered. So I think just kind of having those little bullet points to bring up conversation is the trust building factor with your patients that builds more loyalty. And building more loyalty is going to have those patients refer their friends to come in, because that trust has already been built.
Yeah, no, it's brilliant. I'm excited for AI. I'm very excited about it. And you mentioned something that I think is a perfect time to transition to our next topic, and that's building loyalty and building trust and engaging patients. This has been something that I think has been neglected in healthcare really since the birth of healthcare. If we think about the evolution of healthcare, medications have evolved. Medical technology has evolved. The way we do surgery has evolved. Everything's evolved, right? It's great. It's amazing to be in this sort of era of evolution with technology. But the one thing that has not evolved is patient communications, how we engage with our patients. How do we talk to our patients? How do we build trust with our patients? What are you seeing that are some of the pain points right now when it comes to patient engagement? Just talking to them about, here's what you need to do before treatment, here's what you need to do after treatment, and re-engaging them, having them checked in on, protocols to follow up so they come back. Not only come back to invest more with us, but also they come back because they trust us. They feel like, wow, that healthcare journey was great. I'm going to come back here. What are some of the pain points and challenges you're seeing right now with this?
So I'm seeing a couple different things, Sam. So I'm seeing a lot of clinics that are giving the patients as much information as possible, but it's hard for them to retain that information. So they're calling, double checking, making sure that they're following the right rules and what they're supposed to be doing pre and post their treatments. Or sometimes they, had a laser treatment, they go out in the sun and their skin's all flared up. So I think the communication with the patient not retaining is definitely a key factor, or they're getting a PDF and it ends up in the trash can in the backseat of their car. It's definitely missed.
Happens all the time.
Yeah. And the other thing that I think is there's a lot of staff issues right now, or team member issues inside clinics. So there's a lack of team members on site to be able to help the patient, whether it's through doing follow-ups with the patient, making sure that they're understanding what they're going through and re-engaging them to come back in the door for that 1 month or 3 month follow-up, whatever kind of regimen they're on. So I think it's a couple different differentiating factors, from the information not being retained from the patient, and then the clinic not having enough team members to do proper follow-ups.
Which basically leads to inconsistency.
Absolutely.
So, I want to ask you guys that are listening right now, are you still giving out papers to your patients? Because if you are, listen, that needs to evolve. Every single time I'm given post-care, pre-care instructions, I don't know where that goes. I end up just going to Dr. Google.
Yeah,
I go to Google or Chat GPT and I'm like, hey, what do I need to do before this treatment? What do I need to do before taking this medication? What are the side effects? And
that's not a licensed provider giving you that information.
It could be accurate, it could be not, and that information should be coming from the healthcare clinic. And this frustration that we're talking about, we've solved it. We have finally solved it.
How did you solve it, Sam?
Well, we a year ago, we started to see, hey, this is so frustrating. Our patients are coming in and saying, well, I saw this on TikTok. Dr. Google told me to do this post-care treatment, or YouTube video told me to do this.
My sister did this treatment. I want to do it too.
They're coming in and we're having to battle against this. And we said, okay, this little guy, the cell phone, is frustrating because healthcare providers are literally competing against this guy right here. But we said, hey, why compete against the cell phone? Why not take advantage of the cell phone and lean into it and actually create an opportunity where patients, because they're on their cell phone, let's communicate with the cell phone. And that's where we had designed this app called Looped, keeping people in the loop, looping people into their care, because people don't want to read. You mentioned it. I don't want to read. I like to hear quick nuggets of knowledge. I like to see a video, and that's what this app is. So now clinics can have their own personal app. Patients download the Looped app and they sign in using the invitation from their specific clinic. And then they get uploaded information about here's what you need to do before your medical weight loss treatment, or before your surgery, or before your dental visit, or before your cosmetic treatment. Here's what you need to do after your treatment. And they get a notification, they swipe through videos like social media with verified physicians from around the world, or the physician or provider from their specific clinic who's uploaded
I'm a visual
video.
learner, so and I think a lot of people are.
Most people.
And that's how you can retain that information, short little clips with the verified information.
Yeah, and not just, we're not just seeing this across the younger population, all populations. My father, had some health-related concerns, and he went on YouTube and went on Instagram and TikTok and was sending me videos. I'm like, okay, it's also the older generation as well that are more receptive to videos. They have some trust. Everyone has some level of trust. We don't leave anywhere without this little guy here. We take it everywhere we go. Our life is on here. So we said, hey, let's accept that. But let's curate an ecosystem in which patients can come to it. They see their specific treatment. So if I come back to the clinic and I'm doing a new treatment, the clinic uploads that treatment plan and it flowed through videos, swipe, educates me. And on top of that, as I watch these videos as a patient, I get rewarded.
Rewarded for your health?
Rewarded for actually learning about my health. It's not getting rewards by spending money. That's taking advantage of a patient. Hey, spend money and I'll give you rewards. It's like, all right, well, sure. Every retail industry does that. But in healthcare...
Well, it makes you feel like you're spending money maybe that you don't need to either.
True, right. Yeah, you should be rewarded for just being a good patient. You should be rewarded for educating yourself. You should be rewarded for being a compliant patient. And that's what we do. The Looped app, as a patient watches pre-care information, post-care information, 1 month later, what to keep doing to optimize your care, I'm watching these videos, I'm getting points. And then these points, the clinic can decide, hey, we're going to give a free, vitamin therapy, or we're going to give, free vitamin supplements. We're going to give a discount off a procedure. They can decide what the points are used for. But that makes patients coming back. We gamified patient education. That's what Looped is gamification of patient education to make patients want to actually learn about what to do to be better in their own health, procedure, surgery, whatever it is, whatever industry. That's what a Looped allows us to do. And on top of that, going back to our earlier conversation about AI, it will start to learn, hey, this patient has done this, and this treatment. They're probably going to be interested in all these other ones too. So then the news feed starts to adapt to show them, hey, you're in your middle-aged, 40 years old, post-pregnancy, you've had a couple kids, you've had some weight loss with us, you've had some hormones with us. We should probably show you information about, hey, how do you take care of your long-term impact of your hair or your skin or your skin laxity? Are you dealing with post-pregnancy diastasis or urinary incontinence? Here's some information for you to read.
Not read, actually
for you to watch.
Yes.
Exactly. So it has that sort of smart, because think about it, TikTok, I mean, it's going to show me videos about everything we talked about today.
Yes.
It knows me better than me. So what if we can have a healthcare app that is not trying to take advantage of a patient, that's just trying to teach a patient, but with experts? And that's what Looped allows us to do.
So how would someone get access to this?
So of course, the clinics have to be the ones to bring this into their practice.
Okay.
So they, as a clinic, reach out to Looped. You can go to loopedapp.com and sign up for a free demo. And that's where a clinic can say, hey, I want to provide this to my patients. And it's custom to them. It's not a general universal app. It's custom to that clinic. So the clinic gets to have it. They get to put their content, their procedures, their providers, and their patients with their own rewards. All of it's all theirs. But it starts with the clinic having to bring this on. And my goal and our company's goal is to have this into as many clinics and many specialties, around the nation. We're going into North America, including Canada, and then hopefully extend out to, the other countries, because listen, this is already happening. Patients are already going and trying to look for videos to learn about what they should do before treatment, what they should do after treatment. And they're watching videos. This is not theory. This is fact. Why wouldn't a clinic want to have their own ecosystem of own expert level videos that's gamified? Why does this matter? Why would a clinic want this? It's better patient care, better results because the patient's actually being compliant. They get rewards. They want to redeem those rewards to come back in, which means recurrent revenue. Patients are now wanting to come back in. I now get a ping message 3 months later saying, how are your outcomes? Take a before and after photo within the app. Boom.
Well, it's like the connection that you're building. They care about me. They're checking in on me because, like I mentioned, they don't have enough team members to check up on patients. So if you have a ping or a push notification, it's automated. Yeah. These patients feel like they're kept in the loop and there's someone that's caring about them.
Correct.
They don't know whether it's an automated message or not. Yeah. There's still a message that someone's checking in.
And there's surveys built in too. So like, let's say there's a treatment like, a body contouring treatment that may take 4 weeks or 6 weeks. One treatment for each week. Well, I want to know, how are they doing? How did they feel? Were they happy with their visit? How am I getting that information right now? I'm not. I'm just assuming that they did well. But now within the app, after their treatment, they get pings saying, how was your treatment? And in the app, they say, it was good. It was okay. Could have been better. And now that feedback goes instantly to the clinic and they can take action and say, hey, Alicia, I saw that you weren't very excited about today's treatment. What can we do to enhance your care on your second treatment next week? Rather than just not saying anything and the patient growing frustrated, which is not good for business.
Satisfied, and you lose them. Yeah. And you lose all their friends along with them.
Correct. So this is it. I mean, we are so excited about these topics, about branding and how that's going to continue to evolve. It's so important. If you are not branding in healthcare, if your clinic is not branding on social media, if your clinic is not branding on digital platforms, you will fail. You will shut down. You might as well give up right now. Branding is necessary. It is no longer optional for healthcare. When it comes to AI, it's time to pay attention. Maybe it's too early to invest in AI. I resonate with that. But if you're resistant to AI, you will also fail. Adopt AI, learn about it, research it. You may not have to do it right now. Pay attention because AI is going to be inevitable and you have to figure out how to deal with it and bring it into your practice to make patient care better, but also optimize your experience and optimize your workflow. And lastly, patient engagement, so important. Making sure that you're not just focusing on new leads, but how do we take care of our current patients? How do we want them to learn more about their care, get excited about it with the Looped app? So I appreciate this conversation today.
Thanks for having
me.
We're
looking forward to seeing how all of these topics transpire because they're hot ones. I don't think they're going anywhere. They're only going to build. So I appreciate you sharing your experience and your thoughts today.
Yeah. Thanks, Sam.
For those of you that have thoughts on any of these topics or would like to give your opinion and maybe ask some questions, I definitely encourage positive, constructive conversations in the comments below. And if you are new here and you haven't subscribed, please hit that subscribe. We want to make sure that we continue to educate each other and learn from each other. We appreciate your time. See you next time on the podcast for everything wellness and aesthetics and how to take actionable items towards improving patient care and your businesses. See you soon.